You're broken down and tired of living life on the merry-go-round, and you can't find a fighter, but I see it in you, so we gon' walk it out. Move mountains, and I'll rise up, I'll rise like the day. I'll rise up, I'll rise unafraid. I'll rise up, and I do it 1,000 times again.
Hi, I'm Dr. Scott Perryman with Whole Health Weight Loss Institute, and I'm going to talk to you a little bit about bariatric surgery. The first thing patients and doctors often ask me is, how do patients qualify for bariatric surgery? It's based on their body mass index, or BMI. The equation is actually listed below. The body mass index is calculated by dividing someone's weight in kilograms by their height in meters squared. If your body mass index is between 35 and 40 and you have a medical problem related to your weight such as diabetes, high blood pressure, high cholesterol, arthritis, or obstructive sleep apnea, you qualify for surgery. If your BMI is greater than 40, regardless of whether you have a weight-related medical problem, you qualify for bariatric surgery. The three most commonly performed procedures are the Roux-En-Y gastric bypass, the vertical sleeve gastrectomy, and the adjustable gastric band. The Roux-En-Y gastric bypass requires creation of a small pouch of stomach, which is then connected to your small intestine. By doing this, we effectively bypass the remainder of your stomach, as well as some of the early portion of your small intestine. The result is an operation that is both restrictive and malabsorptive. So we have two mechanisms by which you lose weight with the gastric bypass. Another operation is the vertical sleeve gastrectomy. In this operation, we remove the outer 80 to as much as 90% of your stomach. This takes your stomach down from the size of a football, about 40 ounces, down to the size and shape of a banana, which is about 4 to 6 ounces. This operation therefore has a restrictive component by restricting how much you can take in. But there's more than that. By removing the outer 80–90% of the stomach, we are removing one of the important production centers of the hormone ghrelin. And this hormone is our biggest hunger hormone. And so patients will find themselves less hungry. In addition to this, the rapid egress of food into the small intestine and the lower intestine results in secretion of certain satiety hormones a little earlier than usual. And so there is both a metabolic and a restrictive component to the vertical sleeve gastrectomy. In the case of the adjustable gastric band, a band is placed at the upper portion of the stomach. This restricts how fast and how much food goes in at any given time. This operation does not have a metabolic component and is therefore said to be completely restrictive. A newer procedure which we offer at Whole Health Weight Loss Institute is the intragastric balloon. In this incisionless procedure, a silicone balloon is advanced through the mouth into the stomach with the help of a flexible camera. The balloon is then inflated using sterile saline. The balloon will then remain in the stomach and occupy space. After 6 months, the balloon is easily removed with the help of the flexible camera. Patients can expect to lose between 25 and 30% of their excess body weight at 1 year. The intragastric balloon is indicated for patients with BMIs between 30 and 40, typically having between 30 and 100 pounds to lose. And so now it is time for you to act. Speak with your family physician about a referral to see a bariatric surgeon and get started on your journey towards a happier, healthier life. I'm Scott Perryman. Thank you.
I am light, I am light. I am light, I am light. I'm not the mistakes that I have made, or any of the things that caused me pain. I am not the pieces of the dream I left behind.